Good afternoon, ladies and gentlemen. Best wishes to all of you participants of the 5th International Conference on Biophysical Technology in Dentistry. First of all, I would like to thank you for the opportunity given to me to participate in this international conference. On this occasion, I will present the result of our research about the role mastication in improving TGF-beta level on the inhibition of Streptococcus sanguinis and Streptococcus mutans in gingivitis. As introduction, dental plaque bacteria in chronic gingivitis consists 56% gram-positive and 44% gram-negative species, 59% facultative species, and 41% anaerobic species. The dominant gram-positive species in gingivitis are Streptococcus sanguinis and Streptococcus mutans. Many studies on the development of new classification of antibiotics that relate to bacterial resistance to structure and function of antimicrobial polypeptide are an important part of the innate immune system in living things to deal with pathogenic attack, act as direct antimicrobial, and function as mediators of the initial defense reaction mechanism. Transforming growth factor beta or TGF-beta is a peptide for regulating proliferation, differentiation, and mortality of various cells that can be increasingly secreted by parasympathetic stimulation through mastication. The aim of our research is to evaluate the effect of mastication intervention to TGF-beta levels, number of Streptococcus sanguinis and Streptococcus mutans, and the correlation between TGF-beta levels and the number of Streptococcus sanguinis and Streptococcus mutans. This study involved 42 men aged 17 until 22 years old were divided into 3 groups. Group of healthy with mastication or G1, group of gingivitis with mastication or G2, and group of gingivitis without mastication or G3. The subject who got a treatment had to chew normal gums, equal size, without sweetener and testener, and did the mastication for 1 minute as much as 32 times every morning after waking up in a week. After a week, the subject's saliva sample was collected and the TGF-beta levels and the number of Streptococcus sanguinis and Streptococcus mutans colony were counted with ELISA and RT-PCR and analyzed with Mann-Whitney test and Spearman correlation test. The result of the subject's saliva examination can be seen in Table 1. Table 1 showed that the healthy periodontium group with mastication had the highest TGF-beta levels, while the lowest was the gingivitis group without mastication. In Table 2, it can be seen that the normally tests with Smirnov test show the results are all not normally distributed. Table 3, it can be seen that there is a significant difference in the number of Streptococcus sanguinis in gingivitis group with mastication against the gingivitis group without mastication. And in Table 4, show a correlation between increased level of TGF-beta and decrease in the number of Streptococcus sanguinis. But there was no correlation between increasing level of TGF-beta and decreasing the number of Streptococcus mutans. This research focused on the function of mastication that can cause an increase in the body's immune system, especially the antimicrobial TGF-beta polypeptide, and also on inhibition of dominant bacteria in plaque, namely Streptococcus sanguinis and Streptococcus mutans. The lower number of Streptococcus sanguinis compared to Streptococcus mutans in the study is in line with epidemiological studies that show that the presence of Streptococcus sanguinis that produce peroxide in the early stage of colonization, and with a large number significantly associated with low Streptococcus mutant bacteria, whereas the number of Streptococcus mutants that produce mutacin causes a decrease in the number of Streptococcus sanguinis bacteria. This finding is in line with research on mastication that increased TGF-beta levels, which show that only Streptococcus sanguinis bacteria, which can be significantly reduced by increased level of TGF-beta. But Streptococcus mutans, which does not show a significant decrease by increasing TGF-beta. TGF-beta level in this study show that there were significant differences between the group of healthy Prudentium with mastication to the group of Gingivitis without mastication. TGF-beta level in this group of Gingivitis with mastication compared to the group of Gingivitis without mastication show there was significant difference. This study showed TGF-beta level did not correlate to decreased number of Streptococcus mutants, while for Streptococcus sanguinis variables showed there was a significant difference. The conclusion of this research is mastication can increase the TGF-beta levels in group of gingivitis than the group who did not get the mastication. The increased TGF-beta levels in mastication group correlated with the number of Streptococcus sanguinis colonies, meanwhile the increased TGF-beta level did not correlate with decrease of Streptococcus mutans colony. Alright, that was our presentation. Thank you for your attention.